You're listening to Soundside. I'm Jed Kim, editor for Soundside, filling in for Libby Dankman. In April, 25-year-old Alex Kuhnhausen died of a bacterial infection he contracted at Washington State Penitentiary in Walla Walla. This isn't unheard of. Last year, there were 39 deaths reported in Washington prisons, and according to an independent watchdog, at least 3 of them were from infections. But the details of Alex Kuhnhausen's decline and death raise questions about decisions by prison officials and medical staff, decisions that many believe contributed to his death. Brandon Block is an investigative reporter who's been looking into this, and he wrote about it for Investigate West. He joins us now. Thanks so much for talking about this, Brandon.
Thanks for having me, Jed.
You spoke with Alex's wife, Katie, for your piece. What did she tell you about him?
You know, the things that Katie remembers best about Alex are how much fun he was to be around. She described him as very funny. He was interested in graffiti art. She actually has a tattoo inscribed with his ashes on her arm of a drawing that he made. And then, you know, she talked a lot about the little things that she remembers about him, like how fastidiously he would pack grocery bags or how he could remember the lyrics to almost any song after hearing it just once.
What was Alex incarcerated for?
Alex was serving the tail end of a 17-month sentence for a gun possession felony.
And what initially led to Alex requiring medical care?
Yeah, in early April, he contracted a bacterial infection that unfortunately was left more or less untreated for several weeks, and that eventually spread to his kidneys and his brain, and he ultimately was hospitalized and then died within a few days.
How treatable is that kind of infection?
I'm not a medical expert, but I understand it would be quite treatable. The problem was that although he was seen by several medical practitioners, prison staff, none of them were able to successfully diagnose what was going on with him. The first person who saw him assumed that he had some sort of problem with his mouth and prescribed him a mouthwash. The second person attributed his symptoms to withdrawal, which he had been caught with a syringe before that. Each time he was seen, the staff was not able to understand what was going on, and they importantly chose not to elevate him to further care, not to get him to a proper doctor. And so ultimately this infection just continued to spread and spread.
And I understand that one of the contributing factors may have been that after he was caught with that syringe, he was put into solitary confinement. How did that exacerbate things?
That's correct. Yeah, he spent the last 2 weeks of his life deteriorating in solitary confinement. I would imagine that spending 20 plus hours a day in a cell away from the rest of the population would certainly not make it any easier to access medical care. I think there's sort of an out of sight, out of mind element at play here. And in fact, the Department of Corrections chief medical examiner openly wondered whether the decision to put and keep him in solitary confinement actually contributed to his death. So this is something that people in the department have been discussing internally.
And there have been discussions about the use of solitary confinement. What is the official state policy when it comes to putting prisoners in solitary?
Yeah, there have been a lot of attempts to reduce the amount that the department uses solitary confinement over the last few years. Importantly, the department pledged that it was going to stop using solitary as a punishment in 2021. So their official policy, as they told me, is that they use it sometimes for administrative purposes when someone is awaiting a decision on some kind of disciplinary issue. But really, they're supposed to be using it for people who pose some sort of threat to the rest of the prison population. That's their policy as they've articulated it to me. But in this case, it's really hard to see how the possession of a syringe constitutes any kind of threat. And it would seem that what was happening here, which was that solitary was being used as a punishment for his possession of this syringe, that's a violation of the policy that they've outlined.
So he is put in solitary. While he's there, what's happening with Alex's health and how is he cared for by prison staff?
His health gets worse and worse. And it's sort of one of the things that contributes to him not being taken to see a doctor is that because he's caught with a syringe and he has a history of drug use, there's kind of a thing that happens where each one of the providers, one of the providers attributes his symptoms to withdrawal, and they're kind of preoccupied with his drug use. And his symptoms are sort of shrugged off as being a function of his drug use, really. And so it kind of contributes to not taking his symptoms as seriously as perhaps they should have. There's a medical report that describes him being seen just a few days before he would ultimately die. And the physician's assistant goes into his cell and notes that he's too weak to hold a cup and that he hasn't eaten anything in days. And then it's quite remarkable. The physician's assistant's diagnosis is simply that he's dehydrated, and he just tells him to take his medications and eat if he can. And that's the end of it.
It seems to me that somebody not eating or drinking for a few days would automatically elevate the treatment. But was there any indication of that?
No, and you would certainly think so, right? I mean, one of the first things that happens is he's coughing and spitting up blood, and then of course he degenerates to the point where he's hardly talking and too weak to hold a cup. Yeah, you would think that any reasonable person would say, okay, this man is very sick. This person needs to see a doctor. And I think it's really underscored by the fact that immediately after he is eventually hospitalized, as soon as he gets to the emergency room, the doctor there within 45 minutes diagnoses him as seriously ill and says there's a high chance that he'll die.
Meanwhile, as all of this is happening, his wife, Katie, is largely unaware. I mean, she hasn't heard from him for a couple weeks since he's gone into solitary. She does go in for a visit. At that point, he is extremely ill. What is she told about his condition at that point?
She's told basically nothing about his condition throughout most of the period that we're describing. He is hospitalized and he gets that really grim prognosis that I just mentioned, essentially marked for likely death. He's then airlifted to a second hospital in Spokane the following day. And all this time, his wife is being told nothing. It's not until after he's airlifted to that second hospital, the day after that the department finally notifies her that her husband is in critical condition, despite the fact that she's been calling and emailing, trying to get information about her husband. There's no response until he's essentially pretty far gone. She gets very little time with him before he ultimately dies.
How out of the ordinary is it if somebody who's incarcerated were dying? Would a family member normally be informed?
I would certainly hope so. I mean, I don't know exactly what the policy is or how this normally goes, but it seems really strange that someone would get so little information about their loved one, and I can only imagine how terrible that must feel.
Especially as she's seeking information. Like, how many times did she reach out trying to find out more?
She sent numerous emails and called a number of times during the week leading up to Alex's hospitalization. I don't know exactly how many, but there was one email in particular that was shared with me where she writes in a subject line in all caps, help me, with exclamation points. And that was sent to the prison superintendent on the night actually that he was being airlifted from one hospital to another. So just to underscore the parallel situations here, she's calling and emailing and trying to get information, and she doesn't even know that he's not at the prison anymore. He's been hospitalized and is now being airlifted to a second hospital because his condition is so life-threatening.
So the circumstances around Alex's medical care in prison, they're fairly opaque. What were you able to find out?
So everything I know is from Alex's medical records, which tell you a much more clear story of what happened. There are official reports that the Department of Corrections since 2021 has been required to publish. Unfortunately, those reports don't give you a lot of information about what actually happened and the care they received. They're extremely terse. For example, Alex's report on his death, it offers a very abbreviated timeline of the care he received in the weeks leading up to his death, and the word infection is not in there. So that gives you a sense of of the quality of information and transparency that's being provided by these reports. And it's really concerning to a lot of people because even lawmakers don't have good information about what is happening to people who die in state prisons. I reached out to a lawmaker for this piece, and I had to provide him the records that I had found because all of that he has access to is these official DOC reports. So it's really we really know very little about situations like this and the 38 other people who died in state prisons last year.
Well, there is an independent agency that serves as a watchdog for treatment of prisoners, the Office of Corrections Ombuds. It is supposed to look into these kinds of deaths. So how is that process working?
Yeah, there is a watchdog agency, as you mentioned, and they've actually raised similar concerns about lacking access to key information about inmate deaths in order to evaluate them as is supposed to happen each time someone dies. The Office of Corrections Ombuds, however, has also been criticized by prison reform advocates. Crosscut wrote a piece a couple of years ago about how they shelved several completed reports investigating different aspects of the prison system and have increasingly sought to work with the Department of Corrections and kind of forge these quiet compromises rather than releasing more confrontational public reports. I should say they did release a public report on solitary confinement, two of them actually, but it's not clear to me what, if any, work is going on to help bring more information to light about prisoner deaths.
Those shelving of those reports happened after the initial formation of the ombuds and how it just put out dozens and dozens of reports when it first began. Any idea how active it is currently?
I mean, I know it's active. I've emailed with the current executive director about this story, and they have certainly put out some reports, including the one on solitary confinement that I mentioned, but I'm not aware of any work they've done on prison deaths or oversight of treatment of prisoners who've died. And in fact, one of the shelved reports actually was about medical treatment, but I don't know what's in there because it wasn't released.
It still, to this day, has not been released?
I asked the office director if they had released any of those reports, and she did not indicate that they had.
The Department of Corrections declined to give you an interview for your story. I wonder, since you've been working on this, have you seen any movement towards improving either the way that incarcerated people are treated medically or increasing the transparency of what happens within the walls?
No, unfortunately, I haven't. And I'll tell you another story that maybe illustrate the situation we're in is that there's actually a bill introduced during the last legislative session that was an attempt to get lawmakers better access to prisons that would have required prisons to allow lawmakers in on, I think it was 24 hours notice. And that bill didn't pass, but in looking a little bit deeper into why the bill was ran, it turns out that actually the lawmaker who I spoke to for this article, Strom Peterson, who's a state representative, was denied access to the Stafford Creek facility for, I believe it was over 5 months. He was trying to visit with an incarcerated inmate there who was working on some kind of activist cause. I'm not entirely sure, but they slow walked the visit. So even the lawmakers can't get into the prisons in some cases. So I think that kind of illustrates the issues with transparency that we're dealing with right now. And of course, yeah, they didn't answer they wouldn't talk to me for this story, and they didn't answer any of my questions about Alex's medical care.
So how did you get this information then that you did get?
Yeah, it all comes from Alex's medical records. I've been working closely with his widow, Katie Kuhnhausen, who has been extremely determined in calling attention to this case and has accused the prison of essentially neglecting her husband. And so she has filed a number of records requests in the year and a half or so since he died and obtained a lot of records about his medical care, which form the basis of this article.
Yeah, what is she doing? What is she pushing for?
She's just trying to get some transparency. She has sought, obviously, a bunch of records from the DOC. She's gotten some of them. Others they have declined to give her. She also has pointed out, and I point this out in the article, that Alex's body was never autopsied, which is per DOC policy, something that they are supposed to do when someone dies unexpectedly, and certainly could shed more light on the condition that led to his death. So I think really what she's looking for is just some transparency and some accountability for someone to say, like, okay, this could have gone differently. And at the very least, we're going to investigate what happened here and see if we can try to prevent this from happening in the future. And I think from her perspective, she's gotten stonewalled as she's tried to access information during his life and now also in his death.
I think I read in your story that he was 2 days from finishing out his sentence.
Yeah, he was about to be released when he got sick, and he was ultimately being found with the syringe resulted in a punishment that extended his sentence a little bit. But yeah, he was just weeks from being released, and it just makes the whole situation just so much sadder.
Brandon, is there anything else that you've gleaned from reporting on this that you want to make clear for listeners?
Yeah, I think a helpful way to think about this is what kind of medical care might this person have received if he was not in prison? And I think when you look at the medical care that he received in prison and the number of times that he was seen by providers in prison who were unable or uninterested in figuring out what was going on with him, and then you compare that to what happens when he gets to an emergency room and is seen by a doctor who is not involved with the prison system. Immediately, he says this man is very sick and he's very likely to die. Looking at the broad sweep of these medical records and seeing how the attention and care picks up, and unfortunately they weren't able to save his life, but it's hard to imagine that he would not have received better medical care if he was not in prison. And so I think that's the most sad part of this story to me, is that this was someone who should have lived and could have lived if he'd gotten the medical care that he deserved and is entitled to, as all people who are incarcerated in state facilities are entitled to the same level of medical care. And so it's just really sad that it doesn't appear that happened here.
Well, it's a heartbreaking but very important story that you've written. Brandon Block is an investigative reporter. He wrote his story, How a Washington Prison Turned a Treatable Ailment into a Death Sentence. You can read about it at Investigate West. Thanks again, Brandon.
Thank you, Jed. My pleasure.
Thanks for listening to Soundside. This show is only possible because listeners support us. If you're able to give right now, please check out the show notes for a link to donate. And don't forget, you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m., Monday through Thursday, or anytime online at KUOW.org.